Dr. Archer, from a clinical perspective, what are some of the common presentations? What does elder abuse and neglect look like in the mouth?
So one of our first warning signals is usually if the mouth is so unclean that we can't even visibly see the teeth. So the plaque, you can imagine not brushing your teeth for a number of weeks, that kind of look. So nobody's been able to clean this person's mouth. That's usually number one sign. Number two is rampant decay that's been left there for a number of months. Fractured teeth, broken teeth. When we pull their lip down and we can see that these broken teeth or broken things inside the mouth are actually causing lacerations or lesions or bleeding just on obvious signs. And I think, the biggest is that if a patient hasn't been able to eat because of something in the mouth, why is that? Who's looking inside the mouth? So by the time some patients come to us, they've lost 20, 30 pounds because their mouth has been so sore for an extended amount of time.
It's a really serious issue then.
It's very serious.
Your visit to the doctor now contains a little page where you sign that you acknowledge that the physician's office has notified you about their compliance with HIPAA laws. More often than not, you probably read through quickly or barely skim the authorization form before signing it. However, HIPAA laws are important, and they're in place to protect you from identity theft, being denied care, and/or health insurance coverage. HIPAA stands for the Health Insurance Portability and Accountability Act, enacted in 1996. HIPAA laws created a new national standard in protecting your health information. As you see different physicians or become admitted to different hospitals, your health information should follow you. HIPAA delineates the need to properly protect your health information as it flows through to these different channels. As more and more transactions are completed electronically these days, HIPAA laws focus on the protection of your health information specifically through these channels. So, what does HIPAA protect? For you, HIPAA protects personally identifiable health information, such as your social security number, birth date, address, whatever, as well as current, past, or even future physical and/or mental conditions or treatment. Such information may not be disclosed except for specific uses. Information that HIPAA does not cover must specifically be personally non-identifiable. In protecting this sort of information, there is more protection against identity theft and more recourse if such a thing should ever happen. HIPAA also protects how health insurance providers may use your health information. These entities may use your information without your authorization only if they are sending you information, using this info to provide the best treatment of health care or collecting payment on medical expenses, among other things. If disclosure of your health information doesn't fall under these categories, you've got to authorize the transfer of information in writing. Furthermore, because the government understands that highly technical language can be a barrier in understanding your health information privacy rights, any authorization must be in plain language. This may all seem like unnecessary paperwork, but hey, beyond identity theft, HIPAA laws also help those looking for health insurance coverage. Title I of the HIPAA laws oversees the availability and range of health insurance plans for those without perfect health. It outlaws any health insurance plan from creating discriminatory rules to create premium rates or deny coverage. HIPAA laws are quite extensive, but this gives you a look at how your health information is being protected and used. Your Department of Health should be able